I'm waiting for my trusty watch to say it's exactly 10 o'clock. Good morning, Chris Ohl, Wake Forest Baptist Health, Infectious Diseases. We had last week off. Hope everyone had a wonderful, wonderful holiday. And Happy New Year. I'm kind of looking forward to the next year. Can't be much worse than the last year, but everyone's probably heard that already. So, how are we sitting with COVID? Well, since I think I talked to you last time, across the country, case numbers are coming down slowly, particularly in the hard-hit Midwest and the near West. The problem areas, the big problem areas now are Southern California, Arizona, Tennessee, a little bit closer to home, and then some of the Ohio River Valley. Here in North Carolina, it's not that much different than it was 2 weeks ago. Case numbers have declined slightly, some areas more than others. I don't know if it's a meaningful decline or not, but at least they're not going up. So if you're the glass half full person, I believe they're truly not going up. You have to kind of watch a little bit around the holidays because there's some lags in reporting of cases to the state. So sometimes you can get a little bit of jump up and down on the state dashboard. But I think our numbers have come down some in the last couple weeks. Will that continue? Unfortunately, probably not. With the holidays and with all of the bubble fusions, as I call them, different groups of people getting together, socializing, usually family units. Our case numbers will probably start going up again towards mid-January. You also have to remember January and February are our big respiratory viral months anyway in the Southeast. And so there's a lot of forces that help facilitate transmission of respiratory viruses at this time. So what can you do? Nothing's changed. You wear your mask, avoid crowds of people, and avoid bubble fusions. So stick with the people you know and that you're with in your household or your small pod groups. Wash your hands and wear the mask. I think I said that once, but I'll say it again. Wear the mask. It really does help. Our hospitals have been busy. It was a busy holiday period for our hospitals across the entire state, and a lot of it's because of COVID. Other medical problems too have been, but COVID's the biggie. And our COVID hospitalizations, just about every day has set a record number compared to the day before. That's no different here in the Triad. I would say our hospitals have been resilient and are hanging in there. We really haven't had to pull out any extreme differences in staffing or the way we provide care yet. So some elective surgeries across North Carolina are being asked to be postponed, which kind of makes sense. If you've lived with your creaky knee for 2 years, you could probably live with your creaky knee for another month and a half and free up that nursing staff and hospital bed for other people who need it, who are sick. But emergency surgery and what we call time-sensitive surgery, which is surgery such as for cancer and such, is still being done, and being done safely and without any problems. So that's sort of where we're sitting with hospitals. A lot of questions about the variant. So everyone knows about the 11B variant now that has surfaced in England. Did it really surface in England? Probably not. It's just England spends a lot of time sequencing viruses, which means figuring out the RNA map of the virus. And when you do that, if you see small changes in the virus or mutations, that shows up on sequencing. So England's been doing a lot of that throughout the whole pandemic, actually. And so they have identified it. So this new variant actually is a compilation of other variants that we've seen over the pandemic. And so It consists of 12 small single-point mutations in the protein, the spike protein that's on the surface of the virus that attaches to our lung receptors. We've seen each one of those mutations pop up before, and it really hasn't meant anything. But now with all 12 together, there's some concern that the virus might be more transmissible. Do we know that 100% for sure that it's more transmissible? If you read the papers, you would think we know that for sure, but actually we don't know it for sure. There's just some circumstantial evidence that it's more transmissible because it seems to have taken over as the predominant clade of virus in a lot of places in England. And what a clade means is basically means that if all of a sudden, you have many different colors of cars on the road, all of a sudden you just have blue cars because that clade of blue took over. It's the same way this clade's taken over. That suggests it might be more transmissible because it has an advantage. But there are other things too that can lead to a specific clade of a virus taking over, super spreader events, or getting into certain populations of people who might transmit it between themselves, and then when that population's measured. So we have circumstantial evidence, but no proof yet. To get proof, we need to do some experiments in the laboratory, and those are ongoing. And then we need to look to see if anyone's getting reinfected. So what does that mean? So that means if somebody's had COVID with the usual strain, the normal strain that we had, are they at risk of getting now this new variant? If they are at risk of getting the new variant and getting reinfected by it, then that would imply that the antibodies that were developed for the normal strain may not work against this new strain. We haven't seen that yet, actually, with the new variant. So that's good news, but we have to start looking real hard for that. If we see people getting reinfected with the new variant who had the usual variant of COVID before, then that might imply that the vaccine might not be on target. But so far we haven't seen that either. So in fact, all of the available data shows that the vaccine will work for this. And then lastly, is the new variant any meaner? No, it doesn't seem to be any meaner. Pretty good study done in England, case control study, showed that the number of hospitalizations, severe COVID, and more serious illness is exactly the same. So when you put all this together, we're going to have to try to think, is this new variant really mean much? And right now I'm a little bit on the fence. I'm not so sure it's going to be as big of a problem as some people think. So we'll have to see a little bit as time goes on. Certainly the things that we do to keep from getting COVID, personal distancing, avoiding the crowds, wearing the mask is going to work for the new variant too. And when you think about it, the old variant was transmissible enough anyway. People were getting it without any trouble. So we'll have to see how that all works out. Saw a study this week looking at antibody levels in people who've had COVID in the past, pretty big cohort of people. And so 8 months out, it turns out that the vast majority of people still have measurable antibodies to COVID, which might imply that immunity, if you've had infection, lasts longer than a few months. And we're out to 8 months now. So far it looks like if you've had COVID, more likely than not, you're going to have some immunity to it. There have been some reinfections. I think we're up to like 38 described now in the world. Not a huge number of people that were sure who had COVID in the past got reinfected again. I only know of one case personally myself in the area. So it's not a common event, and that's also good news. Lastly, vaccines. So I would like to remind people that I've been saying all along that the rollout of the vaccination program for COVID is going to be bumpy, and it's going to take some time to get people vaccinated. And I know there was a lot of excitement, and I think in people's minds they thought that as soon as the vaccine got released and it was out there that we're done. But it takes a long time to vaccinate lots and lots of people that we need to get vaccinated. And yeah, the rollout's been a little bit bumpy. Criticism in hospitals with prioritization, that's been across the country. And then, our nursing home programs still really aren't up off the ground yet. I think they will be next week. So yeah, it's been a little bit bumpy. But, I'd like to remind people that 3 weeks ago, we didn't even know what our prioritization systems were going to be here in the state. And the vaccine rolled out, right before the holidays, which if you're going to put a vaccine program together, that's probably the worst time to do it. And a lot of the information in the EUA that came out from the FDA and the ACIP didn't come out until 2 days before the vaccine was shipped. So it's going to take a little bit of time for people to up ramp, so I appreciate some patience. The prioritization system on who to get vaccines first and such is actually, if you stop and think about it, a lot more complicated than you'd think. So how do you want to prioritize? Do you want to prioritize people who are most risk for getting severe COVID? Do you want to prioritize people who are most needed to take care of our society and our people as COVID's going forward? Do you want to prioritize as people who are most at risk for being exposed to COVID? And all of these priorities sometimes don't intersect in the same way. And so you end up with fairly complex prioritization plans. And in ours in North Carolina, while it might seem simple when you first look at it, when you really parse it out, it is a bit complicated. And if you're a vaccinator, how are you going to go about doing that and identifying those people, calling them down and getting them vaccine, and at the same time policing to make sure that people are in the right priority system. And then doing it with a vaccine that once you've thought it out, you've got 5 days to use it for Pfizer's vaccine. And so it's a little bit more difficult than you'd think. Second doses are going to start coming around next week, which will add a little bit of a layer of complexity for our health departments and for our hospitals and healthcare systems. So here in North Carolina, the plans for the next phase beyond healthcare workers or frontline healthcare workers taking care of COVID was rolled out yesterday. Probably will get going around the 11th of January or so, and that'll be called Phase 1B, and it basically involves people at higher risk of getting COVID, the elderly, or getting severe COVID, I should say, or having complications of COVID, the elderly, and then a lot of essential workers, and the list of that's long, and then everyone who's been in the priority system now will still be in it. So we're going to start out in North Carolina doing people over the age of 75 first. So that's where the emphasis is going to be with our health departments and with our health systems. And we'll have to see how that rolls out. And it's going to be different for every hospital and every health system in every county. So, but all those plans are being put in place now. So I think for the next 3 weeks or so, the first priority in our public at large, people who are not involved in healthcare, will be those over the age of 75. And so that's something to look forward to when we do it. The vaccine needs to be treated a little bit with respect and kid gloves. It doesn't like being jostled around. It doesn't like being transported once it's thawed out. And so once the vaccine is thawed, we have to be really careful with it and not move it around as much. And that means that a lot of the ways that we usually give vaccines, like our flu shots, are going to be a lot harder to do. How do you get your flu shot? Most people get it at their doctor's office, or they get it at a flu shot campaign associated with their doctor. So a lot of doctors' offices probably won't be able to give this vaccine, at least the Pfizer vaccine, easily because of the transportation and the cold storage. So I think you're going to be seeing more vaccine clinics that come together either within a health system or within a county jurisdiction for giving vaccines rather than getting it directly from your own personal physician. We'll have to see how that rolls out. With time, that'll probably change some, but initially I think that's what you're going to see. You have to register with the state to get the vaccine, and there'll be more coming out about how to do that. The easiest way to do it is to do it online before going to get your shot, but the problem is right now you can't do that unless you're affiliated with a county program or a healthcare system, so that'll have to get changed in the next couple weeks. You can register on site, but it takes longer. But the shot itself is the easy part. If you saw me on TV, I didn't even know I got it when they gave it to me. I was a little bit sore afterwards, the day after, but that was it. So that part's actually the easy part associated with vaccination. So a little bit of patience, and we'll get everyone vaccinated. And as time goes on, it'll get faster and faster and faster and faster. So I've been asked about drive-up flu or COVID shots. So, drive-up flu has been around for a while. You drive up, you get your flu shot, and then you drive away. And that's been proposed, and even there's some places planning on doing that. Personally, I may not be embracing that so much early on because there's some anxiety amongst people before they get their shot, and when somebody's really anxious and you give them a shot, sometimes they feel a little woozy afterwards. And I don't think we want to see a lot of woozy drivers around Winston-Salem, so it's something to think about anyway with the drive-up flu clinics or COVID clinics for vaccination. Testing is fine, but for vaccination, it has to be done a little carefully. People have to be observed for 15 minutes after they get their vaccine, which makes it a little bit more complicated to do it in a drive-up sort of situation. So a little bit of rambling about vaccines, but as I've been saying, the vaccines are ticket out of here, when it comes your turn, and get your vaccine, both for you and your family's protection, but also for our societies and community. The more immunity we have, the harder it is for the virus to move around. So with that, I'll see if there's any questions. May have addressed most of them. But. Yep.
A couple, let's see here. We talked to people at Moses Code yesterday, and they said they're about 80 to 90% capacity of their COVID cases. What's the Baptist's capacity?
Yeah, people ask me what are we at for our percent capacity? That's a really hard number to come up with because your total number vacillates and changes depending on your staffing that day, how many nurses are available, and so on and so forth. So so I'll just summarize it and say, all the hospitals that I've talked to are pretty busy, and every time they say, well, we're pretty much at capacity, it seems like if they get more patients, they find more capacity to for those patients to fit in. So, but it's tight. It's tight right now throughout the whole state.
Does that concern you, or you feel like you can handle it?
We're going to be able to handle anything one way or another. You just change how you do things, right? So, yeah, we're going to be able to handle our patients with COVID. But it's just how much do you have to disrupt what you otherwise would normally do? So, it's the same thing in your household. You can handle just about any disaster at some level or another, but it's more disruptive. So, right now, because of planning and working with our surge plans that we've already put out, the disruptions have been few. I won't say non-existent, but few. But yeah, I think we're going to be able to handle it. It's just you do what you have to do to handle what you have to handle.
And another question, and this is kind of a retrospect. I mean, end of the year now. Tomorrow's a new year. 2020. How do you reflect on what we have faced, and then what is your aspects for the new year? Do you feel like that they're light at the end of the tunnel, or just
Well, that's a tough question, Eric. So what's my reflection on 2020? Light at the end of the tunnel. So yeah, 2020 was tough. We went through a lot. We learned a lot. And I think Governor Cooper, I may not be paraphrasing correctly, but said yesterday we've gone through a lot, but we've learned a lot, and we've learned a lot about ourselves and a lot about ourselves as a community. And I agree with him. That's true. I think I'm really optimistic about the new year. And I've said this here before. I think as we get into spring and the azaleas come out and it starts to warm up, the number of cases will go down. We'll get more and more people immunized as more and more vaccine rolls out, and as we get better at getting it into people. And I think as we get into summer, things will start to feel a little bit more normal. And then hopefully by this time next year, we'll be at the light at the end of the tunnel. But I can kind of see the light at the end of the tunnel now. It's just a little ways off yet, but I see it. So that's what my prediction is for the new year. All right. See you next week.